if the drug is increasing the availability of serotonin in the nerve cell, right? And we say it's not that simple. Our mood's not related to one neurochemical. There's no deficiency. There's no abnormality.
No.
Then what happens when you interfere with, I guess, what is a natural, normal process of brain like functioning?
It doesn't like that. The brain doesn't like that. We might like the effect. That's really important to distinguish. Like we can certainly like the effect of a drug, just as we can with alcohol or drugs or caffeine. We can find it appealing, I don't know if that's the right word, attractive, relieving, while the body underneath dislikes it. Those are two very, very different things. And regardless of how much or how little we like what the drug does to us, the body for sure does not like it, and it adapts. So this is really where these two questions are connected, like how psychiatric drugs work and how to come off them. Because how to come off them, we have to understand what they're doing to the body at first. So if we are interfering by increasing or decreasing a biological system that is not out of balance, we disturb rather than fix, and that's what makes the body adapt to it. Exactly.
Okay.
So the drugs work, like they work in the sense that they have an effect. These are psychoactive substances. When we put into question their effect, it's not to say that they're inert substances. Obviously, they do something.
Right.
Yeah.
So, like if, for example, let's say I have severe social anxiety.
Yeah.
You know, it's just hard for me to hold a conversation with somebody, and being out in public kind of makes me a little bit jittery, and I'm in my head a lot.
Yeah.
But give me a few vodka clubs.
Yeah.
And I flow in the conversation. It's like a social lubricant, right? Is that similar in comparison? Would we say that alcohol is an anti-social anxiety
I would say that.
medicine?
I would say that. If we had to use that same,
Okay.
Sounds weird. At least the principle and the mechanism by which it works is the same. Yeah, alcohol might actually be more effective than most antidepressants in that situation because it has an acute effect.
Right.
So, you're not solving the problem. You're probably just numbing some of that can feel. It makes sense. It's really important to tell that story. It makes sense. Social anxiety and depression and all these sufferings are real experiences. And it is not rocket science that anything that numbs them or covers them up or just gives you a little bit of distance to those thoughts or emotions or sensations. It's not rocket science that can feel relieving, but that's not the same as saying it's a permanent solution, is it?
Yeah, and I think language is powerful, right?
It is really.
So when we use the word medicine,
Yeah.
we're communicating something to the general public. We don't say alcohol is medicinal.
No.
Right?
No.
Why don't we say alcohol is medicinal if it helps with social anxiety?
Yeah. Well, we could. Or we could do it the other way around. Instead of putting those kind of substances into the medical category, we could do it the other way around. We'd put the substances in the medication category into the drug category. Saying there's no good argument to cross a line and saying these are the substances and these are the medications. It's one category.